Welcome to today's session on osteoporosis. In this video, we'll explore everything you need to know about osteoporosis, including its causes, symptoms, signs, investigations, treatment options, and referral criteria. We will also go through some USMLE-style questions to test your knowledge. USMLE-style questions. Question 1. A 70-year-old woman presents to the clinic with back pain and difficulty walking after a minor fall. Her medical history includes smoking and long-term corticosteroid use for rheumatoid arthritis. Which diagnostic test would best confirm a diagnosis of osteoporosis? Answer: bone mineral density, BMD, scan. Explanation: a BMD scan is the gold standard for diagnosing osteoporosis. It measures bone density and helps to assess fracture risk, particularly in postmenopausal women and individuals with risk factors like corticosteroid use. Question 2. A postmenopausal woman with osteoporosis has a history of hyperthyroidism and a parental history of hip fractures. What non-pharmacological intervention would be most effective in managing her osteoporosis? Answer: ensure adequate dietary intake of calcium and vitamin D, along with therapeutic lifestyle changes such as increasing physical activity, reducing smoking, and minimizing alcohol consumption. Explanation: these interventions help improve bone health and reduce the risk of fractures. Maintaining adequate levels of calcium and vitamin D is critical for bone strength. Question 3. Which medication is appropriate for a 65-year-old man with osteoporosis and a high fracture risk, especially after consulting a specialist? Answer: bisphosphonates. Explanation: bisphosphonates are commonly prescribed for high-risk patients to reduce bone resorption and increase bone density. Other options include hormone replacement therapy, denosumab, and teriparatide, depending on individual patient needs. Question 4. A 55-year-old woman with osteoporosis has been advised to take 1,000 mg of calcium and 400 IU of vitamin D daily. What is the rationale behind this recommendation? Answer: to ensure adequate calcium and vitamin D intake for bone health and to prevent fractures. Explanation: calcium and vitamin D are essential for maintaining bone density and strength, particularly in individuals at risk for osteoporosis. Question 5. When should a patient with osteoporosis be referred to a specialist? A. Only if experiencing severe pain. B. In all cases for further evaluation and management. C. After trying over-the-counter calcium supplements. D. Only if there is evidence of fractures. Answer: B. In all cases for further evaluation and management. Explanation: all patients with osteoporosis should be referred to a physician or orthopedic specialist to assess the risk of fractures, manage underlying causes, and initiate appropriate therapy. Osteoporosis. Osteoporosis is a systemic skeletal disease characterized by low bone mass and deterioration of bone tissue. This condition leads to increased bone fragility and a higher susceptibility to fractures. Elderly individuals, especially those with poor walking balance and vision, are at high risk for fractures. Risk factors include a parental history of hip fractures, advanced age, postmenopausal status, smoking, alcohol abuse, immobilization, inadequate intake of vitamin D and calcium, prolonged steroid use, hyperthyroidism, hyperparathyroidism, type I diabetes mellitus, rheumatoid arthritis, malabsorption syndromes, and low femoral neck bone mineral density, BMD. Causes: imbalance between new bone formation and old bone breakdown. This leads to weakened bone structure. Bone mineral loss: over time, bones lose their mineral content, becoming less dense. Low bone density: reduced bone density increases the risk of fractures. Symptoms: back pain, often due to vertebral fractures or deformities. Inability to walk after a trivial fall, indicates possible fractures due to bone fragility. Signs: deformed limbs, resulting from fractures that have healed improperly. Fractures, particularly in the wrists, hips, and spine. Stooping stance, caused by compression fractures of the vertebrae. Investigations. X-rays of wrists/hips, to assess fractures and bone integrity. Bone mineral density, BMD, scan, a key diagnostic tool for measuring bone density. Quantitative CT scan, provides detailed images of bone and helps assess fracture risk. Treatment. Treatment objectives. Manage underlying risk factors, address any modifiable risk factors to prevent further bone loss. Prevent fractures, by strengthening bones and improving balance and coordination. Provide early treatment for fractures, to reduce pain and prevent complications. Non-pharmacological treatment. Adequate dietary intake of calcium and vitamin D, foods rich in these nutrients support bone health. Therapeutic lifestyle changes, include quitting smoking, reducing alcohol intake, increasing physical activity, and improving walking balance and vision. Pharmacological treatment. A for low fracture risk. Calcium with vitamin D, oral. Adults, 1000 to 1300 milligrams of calcium daily and 200 to 800 IU of vitamin D daily. B for moderate fracture risk. Calcium with vitamin D, oral. Adults, 1000 to 1500 milligrams of calcium daily and 200 to 800 IU of vitamin D daily. C for high fracture risk, consult a specialist for any of these therapies. Hormone replacement therapy, HRT. Estrogen therapy, ET. Bisphosphonates. Calcitonin. Selective estrogen receptor modulators, SERMs. Denosumab. Strontium. Teriparatide. Referral criteria. All cases should be referred to a physician or orthopedic specialist for comprehensive evaluation and management. Specialists can offer advanced diagnostic and therapeutic options, including tailored pharmacological therapy and guidance on lifestyle modifications to manage osteoporosis effectively. Osteoporosis. Osteoporosis is a systemic skeletal disease characterized by low bone mass and deterioration of bone tissue, which leads to increased bone fragility and a higher susceptibility to fractures. The risk of fractures is particularly high in elderly individuals with poor walking balance and vision. Some common risk factors include parental history of hip fractures, advanced age, especially in postmenopausal women, smoking, alcohol abuse, immobilization, inadequate intake of vitamin D and calcium, prolonged steroid use, hyperthyroidism, hyperparathyroidism, type I diabetes mellitus, rheumatoid arthritis, malabsorption syndromes, and low femoral neck bone mineral density, BMD. Causes. Imbalance between new bone formation and old bone breakdown. Bone mineral loss. Low bone density. Symptoms. Back pain. Inability to walk after a trivial fall. Signs. Deformed limbs. Fractures. Stooping stance. Investigations. X-rays of wrists/hips. Bone mineral density, BMD, scan. Quantitative CT scan. Treatment. Treatment objectives. Manage underlying risk factors. Prevent fractures. Provide early treatment for fractures. Non-pharmacological treatment. Ensure adequate dietary intake of calcium and vitamin D containing foods. Implement therapeutic lifestyle changes such as reducing smoking and alcohol consumption, increasing physical activity, and improving walking balance and vision, based on the risk factors mentioned above. Pharmacological treatment. A. For low fracture risk. Calcium with vitamin D, oral. Adults, 1000 to 1300 milligrams of calcium daily and 200 to 800 IU of vitamin D daily. B. For moderate fracture risk. Calcium with vitamin D, oral. Adults, 1000 to 1500 milligrams of calcium daily and 200 to 800 IU of vitamin D daily. C. For high fracture risk, consult a specialist for any of these therapies. Hormone replacement therapy, HRT. Estrogen therapy, ET. Bisphosphonates. Calcitonin. Selective estrogen receptor modulators, SERMs. Denosumab. Strontium. Teriparatide. Referral criteria. Refer all cases to a physician or orthopedic specialist for further evaluation and management. Osteoporosis is a common but manageable condition. Understanding its risk factors, symptoms, and treatment options can significantly improve patient outcomes. Stay informed, ensure adequate calcium and vitamin D intake, and seek medical care when necessary.